The Ministry of Health on Monday, 27 February 2023, validated the National Trauma and Injury Plan at the Sadauda Kairaba Jawara International Conference Center. The aim of the National Trauma and Injury Plan is to create a framework for the development of an improved system and network over the next 10 years. Speaking at the validation meeting, the Minister of Health, Dr. Ahmadou Lamin Samate, says injuries are one of the leading causes of immobility and mortality in many countries in the world.
Gambia happens to have a higher rate of deaths due to accidents and injuries than many other countries, even in the developed world. So we actually have a bigger share of the morbidity and mortality associated with trauma and injury. The issue with trauma and injury, we are all prone to development of other diseases, but probably we are more prone to development of trauma and injury than others. It could happen where we are here. It could happen when we just leave this conference center, because the predisposing factors are always there. We ride in cars, we ride on the roads with all the challenges that are faced by road users.
Dr. Samate added that most of the injuries are road traffic accident related.
There's equally a rise in domestic injuries. Fortunately, we do not have civil strife that causes a whole lot of injuries, but we're seeing, as the experts will tell you, an epidemic of trauma and injury in our region, and also Gambia is equally not left behind. There are a number of factors that are responsible for this. If you talk about the road traffic accidents, the caliber of vehicles that ply the roads need to be looked at. Too often than not, it is the commercial vehicles, the gele-geles, that are filled to the brim, usually overloaded, and those would have been vehicles designed to actually convey goods, and they are transformed to become human carriers. Some people in some other parts of the world call moving caskets, because the structure itself, the way the seats are designed, in fact, those seats really are responsible for impalement when accidents occur.
World Health Country Representative of the Gambia, Dr. Desta, said emergency health care should be accessed without payment.
If a person comes with emergency and then the person has no money, it doesn't matter whether the person has money or not, the person should receive the care, and money should come later because it's a life-saving matter. This is one thing that was also requested from member states to look into. I hope this is the case in the Gambia also. And the other one is I think, which has been done from what I understand now, that we have a plan, and this is preceded by the assessment of the care that's available in the Gambia, and that's encouraging. So that's why I'm very happy to see we are advancing already in these issues in the Gambia.
Dr. Keba Marena gives a brief introduction to the trauma and injury plan.
Looking at the road traffic accident burden for the country, we did a little audit of 1 year between 2020 and 2021 November. And we recorded, this is EFSTH alone, recording over 100 serious injuries per month and over 1,200 in that 1 year period. And during that 1 year period, we averaged about 17 deaths per month, so over 200 for the 1 year period. The majority of these were below the age of 25, mostly male, over 60%, and often it was pedestrians who were hit by cars, and often motorcycles being hit by cars, so the less protected people. As you all know, we only have one neurosurgeon in the country who is present here, and as you can see, most of the deaths, not due to anything that he is not able to do. But we know these are the more severe injuries, the head injuries and the spinal injuries, and they tend to be the ones that claim most of the lives. Of course, injuries are not just road traffic accidents. Yes, it's what we hear a lot and what we see a lot, but a lot of other causes of injuries. We've heard about workplace injuries, falls from height, assaults, and sports injuries, which are also becoming increasingly common.
According to research, trauma and injury encompass one of the leading causes of death and disability in the world. Developing countries where financial and medical resources are surely lacking bear a greater proportion of the burden of injuries. Reporting for Kerr, Fatou, I am Mamingom.